This is a recording from our 2023 Core Anesthesia Conference. We want to say thank you to all of the speakers who took the time to come and present, and also the sponsors who made the event possible for all of the residents. If you want to learn more about the speakers or our sponsors, please check out the show notes, and please enjoy this pre-recorded session.
Tanner's going to start us off here with our test-taking strategies, and we'll talk a little bit about how we did things not so right at the very beginning of school and how we kind of perfected it going through school. And then after talking with people across the country about their different strategies, et cetera, we've kind of put this together. And if you were at our conference in the winter, we covered a lot of the same material. So I apologize. It will be repetitive for you if you were at that conference.
This is something that I hope today's conference, if anything, hearing Dr. Horvath talk about mental health, hearing Joe talk about the struggle of finding a first job, here talking about test taking strategies, I hope that if you are feeling frustrated in school or stressed in school, that that is not an isolated issue, that we have all been there. We have all struggled with different aspects of school. And this is no different. Test taking for me was a huge source of anxiety. I am not a good test taker by nature. I overthink things way too much. And this is something that I really had to work through. And it's been something that I really enjoyed teaching with Cole to help you guys maybe avoid some of the mistakes that I made, especially early on. So if this is something that resonates with you, that's great. You're not alone if test taking is something that you struggle with. So let me move on to the next slide here. So test anxiety, what's really going on? I think that's the first place that we need to start before we can start talking about strategies and what you should do. Let's first understand the problem. So one of the problems is you do not understand the information fully. So maybe you have all this information coming at you with anesthesia school, and you know better than anyone that it is just nonstop information after information after information. And it's really hard to keep everything memorized, keep everything understood. You're reading a ton. You have all these PowerPoints. How do you retain all this information? So many times you come to a test and you think, I kind of went through this material. I sort of know it. I tried my best to understand it, but I don't know it fully. And so I'm anxious about what are the fringe material things that they could ask about that I just don't know. They also could be an issue of actually with the test. So you may think that you know the information really well, but maybe you don't like the way this specific professor writes their test, or the questions they ask you might feel are tricky, or the classic nursing problem, what's the best answer amidst four correct answers. And so you can have some issues with just the specific test of not knowing, is this a trick question or, the wording's kind of funny, those types of things. The next one I already touched on is, again, often there are two or more correct answers. We'll talk about how we work through this when we talk about our test taking strategies specifically later in this talk. But this is another thing where you get down to two answers and you think, okay, I know this material. I think I know what they're asking, but these are two pretty good answers. And this can cause some severe anxiety while you're taking the test. Here's an example of a question that we came across. So a 59-year-old male presents for an emergent lap ABI. Significant history includes COPD, asthma, TIA without residual, hypertension, hyperlipid, stage 4 kidney failure, liver failure, and has diabetes as well. Which of the following is an appropriate choice to achieve muscle relaxation? Dream patient, obviously, they have everything that's going wrong with them. And so now we're looking at a very sick patient. Our primary goal is to figure out what we're going to use to achieve muscle relaxation. And now I'm going through the answers. So this is how my brain works when I'm looking through the answers. Okay, so first we have CIS, 0.4 milligrams per kilogram. That dose seems pretty high. So is this, I kind of like CIS for this answer, but the dosing seems a little off. Is that, trying to trip me up here? A lap ABI doesn't really take that long. So maybe that's what they're getting at. This is a dosing question. Rock, it's what we usually use on most everything. This is probably a good answer. I feel like I use it on every anesthetic. So that could be an answer that you use here. VEC, I think there's some involvement with being cleared in the kidneys. So that might not be good for, obviously, the kidney failure. Atracurium, I think this is in the same class as CIS, but one of them releases histamine. So again, this could be a good solution. And so you can see how through these, you can start to get really twisted up in trying to make every answer fit into this question. Here, this question is most likely just asking about Hoffman elimination. And so you're getting to cis being the answer here for this patient with their comorbidities. Again, we'll talk about how you go through this systematically here coming up, but this is just an example of how my brain works, how I can make a solution for every answer typically, or try to fit it into the question. And we'll talk about why that's not helpful moving forward. Second guessing, this is another thing that I am notorious for. It kind of plays back into what I just did with that example question of where you can make things fit. So you know enough, but you can talk yourself into other potential answers. Oftentimes, this carries over from one question to the next. So maybe you answered this question and you thought, I really think it could have been, one of these. And now your confidence is a little shaky moving into the next one. Maybe you think you know the answer. But again, that second guessing and that lack of confidence from previous questions can roll over into the next question. Often this will result in lower test scores simply because of this overthinking and second guessing. Next, we're going to talk about why you should have a strategy. And this is where Cole really is he helped me so much, especially starting out. So I'm going to let him take this part of why we're supposed to have a strategy. And then we'll go back through and talk about exactly what that timelines look like for studying. And then we'll do some practice questions here as well.
Yeah. And so the biggest thing that we learned when we got into anesthesia school was you can't just fly by through these tests just simply by understanding some of the material or memorizing facts like you could maybe in undergrad. And the reason is there's just so much information that is jam-packed. You're flying through content. You forget about half of it the next week. And you may have known enough the day of your school exam, but then when you get to boards down the road, how do you ensure that you're going to remember all this stuff in order to take a test on it? It's totally different when you get to standardized tests, when you get to the C exam, when you get to your board exam, let alone getting through school and passing those tests. So it's more than just simply understanding the material and memorizing facts. There's a lot of test taking skills that go into it that's going to greatly improve your chances of selecting the right answer to these questions. So basically, we're going to break it down into two parts. We're going to break it down to pass a test. There's two main things you have to have. Obviously, you have to have an understanding of the topic and curriculum. We'll spend 3 minutes talking about that here in a second. But the main one we want to talk about today is number 2. How do you take that knowledge that you know and have a logic-based ability to work through the design of a test question? And this, like I said, is independent of that knowledge. So you are going to have that knowledge up front, but you need to have a logic ability to be able to increase your success rate and your chances on each and every multiple choice question. So first, let's talk about what's the difference between knowledge and understanding. And I feel like this is taught pretty basic early on in undergrad, but we are really big proponents of not having just knowledge. We really have to have understanding. Knowledge is just fact-based learning. So 1 + 1 = 2. The pKa value of a certain local anesthetic. It's stuff that you just memorize. It's knowledge-based. Understanding then is your ability to take that knowledge of multiple facts and put it in this concept map in your brain about how it connects, how it makes sense. And that's the way that we studied through school. And that's the way that, honestly, we studied by doing our podcast, by making these episodes. If we were able to discuss it, then we knew that we understood it. We weren't just reading and memorizing facts. And so understanding then takes, the fact that is maybe hemoglobin carries oxygen, but hemoglobin also carries carbon dioxide. And then you throw in your understanding of gradients and how things shift, and you're able to connect the dots as at the lungs, when the capillaries of the lungs or of your blood are passing the lungs, gradients are going to cause more CO2 to leave the hemoglobin there and transfer into the lungs, whereas oxygen will pull into the capillaries and go onto the hemoglobin there. And then you get to the tissues and the exact opposite happens. And you start creating this picture. And based on that picture, you're then able to connect pH values, carbon dioxide values, the whole pH system. And we kind of did like an ABG talk a few weeks ago. We did 2 episodes on that. And if you understand that pathway and that concept, you don't have to memorize all the facts associated with that. You have to memorize just a handful of facts and create a concept map to put it all together. And we'll go through one of the main ones here in just a minute. So again, understanding information is key, not just memorizing. And if you try to memorize every fact in anesthesia school, I'm just going to tell you right up front, you're not going to be able to do it. It's impossible. You may be able to do it for your regular test and get by test after test after test in school. But then you get to boards and you're going to realize that you set yourself up for failure because you were able to memorize something to get through that week's exam, but you did not set yourself up to be able to pass your board exams because you can't go back and rememorize everything. And then when you start to work, you're not going to necessarily have everything presented to you as a memorization list of material when you're in the field and a crisis comes up. You need to understand the concepts of how things work in order to take care of those patients. So Tanner, do you want to go through this part, and then I'll kind of go through a whole process of understanding a topic when we get to our first question?
Absolutely. The one thing I will mention, what Cole just said, obviously there's still things that are just knowledge-based. And Cole already alluded to this, but you want to have understanding, you want to connect the dots, you want to understand how, like Cole was mentioning, that simple knowledge base of hemoglobin and oxygenation and carbon dioxide leaving the vasculature. You want to understand that at a base level, but then that connects to so many other things. There are still going to be memorization things that you just have to keep reviewing. And so what we aim to do is we want to change your studying from majority being on memorization and then adding in some, understanding on the side to be mostly understanding. And then you're also obviously still going to have those memorization topics that you need to keep track of. But we think changing this framework is going to help you so much more, again, not just for the test that's on Monday, but when you get to the C exam and when you get to the NCE, and then when you're actually practicing, I think it'll be a much better model for you. When we're talking about actually taking the test, so this was very helpful for me when, again, I already explained kind of the struggle that I had with overthinking and second guessing. Here's how we changed taking tests, and that really helped us. So for a standard multiple choice question, you have 4 answers. Obviously, you have 25% chance of getting the correct answer. And so typically what I did is I would read the question and then I would go through the answers and I would try to find the correct answer right away. And that's why I could make typically all 4 answers, or usually all 4 answers, make sense in some capacity. Instead, try to go through and eliminate wrong answers and then go back to your correct answers. This is helpful for going through and understanding what is the question really asking. And then once you understand what the question's asking, going through and saying, well, this doesn't match with that. I can understand maybe why, you could make a scenario where this could be correct, but you start going through and you start eliminating things first. And that 25% chance increases to 50, increases to 75% chance. And then obviously, hopefully you get to the point where you're down to just one answer. When, again, we're taking multiple choice and you don't know the answer. So let's say that this is something that is on a C exam or NCE, and this happens quite a bit where you're like, I've never even heard of this disease process. I think I maybe remember going over this, but I don't know the answer and I don't even know how I'm going to get to the right answer. This is a solution where you can just increase your chances of answering this correctly, even if you don't know what the question is asking. So either you have an answer that is going to contradict what the question is asking, you can eliminate that right away. Or if you have 2 of them that are pointing in the same direction, or they're going in the same rationale, you can eliminate those as well. So if you have 2 that say, I'm not going to come up with an example right now, but 2 that are kind of in the same vein of an answer, multiple choice, you're only going to be answering 1. So you can go ahead and get rid of those. On the same token, if you have some that are going opposite directions, those are ones that you're going to want to pay attention to and maybe consider that one of those as a higher likelihood of being the correct answer. So if you can go through and eliminate something that is obviously contradictory, or you can find something that is going in the same direction and eliminate those, again, we just are increasing our chances. That's all we're doing at this point. If we don't know what the question's asking, we don't know, what the content, now we're dealing with just strictly test-taking strategies, try to work through those answers and figure out how they might correlate with one another. So let's practice this. Cole, why don't you take this and go through this question and show us how you can use this test-taking strategy.
So for this question, it says, which of the following statements is true about respiratory acidosis? So A, pH levels are increased. B, respiratory rate is increased. C, H or hydrogen ions concentration is decreased, or D, plasma concentrations of potassium will trend upward. So I'll give you guys a split second to think about that. So let's rationalize here from what Tanner just talked about is instead of just jumping to one answer that we think is correct, how do we eliminate other answers? And at first you may think that this is going to take a lot longer to go through a test like this, and you may not finish in time. That's a lot of the feedback I get with this method. And when I'm teaching people is they say, well, this is going to take me way longer. You're actually going to find that most people, once they've figured this out, it takes them faster to go, or it doesn't take as long to go through a test because they're able to narrow down and get that correct answer a lot quicker rather than sit there and contemplate back and forth on different answers. So when you look at this, what do we know about respiratory acidosis? So first we have to apply some sort of knowledge. Well, we know that respiratory acidosis is acidosis for one is when pH levels are going to be lower than 7. So that's an acidotic state. So when we look at A, we know that pH levels are increased. So we know that can't be the right answer right away. But if you didn't even know that fact, look at A and C. A says the pH levels are increased. And we know that when you have an increased pH, so when you're more of an alkalotic state, what is that going to do to your hydrogen concentration? Well, your hydrogen concentration is going to be decreased when you're in an alkalotic state. So instantly, even if you didn't know what respiratory acidosis was, you know that A and C cannot be the right answer because they both point to the same direction. So you can eliminate those right off the bat. So now you're down to B and D. So B says respiratory rate is increased. And then D is the plasma concentrations of potassium will trend upward. So what do we know about respiratory rate? So when you increase your respiratory rate, what are you blowing off? You're blowing off more carbon dioxide. And this is where that knowledge factor comes in. You have to have some sort of knowledge. You know that CO2 and pH are inversely proportional. So as CO2 is lower, that means your pH will be higher, which fits with A and C. So all three of those point to the same direction. So you're going to eliminate those, which leaves D as the correct answer. Now, if you don't know why D is the correct answer, here's the reason why. And exactly, Kevin just posted it in the chat. As your hydrogen ions increase in the body and you get more acidotic, you have a lot more hydrogen ions in the plasma. They want to, based on diffusion, based on gradients, they're going to push themselves into the tissue. And the body wants to stay electrically balanced in its charges. So as you shift a positive ion across from the plasma into the tissues, the body wants to exchange and bring one back out. So it brings potassium back out into the plasma, which means you're going to get a higher serum potassium level. Now, you could, if you were like Tanner and you're looking for what is the right answer, you may even know that D is the right answer, but you might have picked B. Because you might have said, well, is my respiratory rate going to be in response to the respiratory acidosis? Is it the cause of the respiratory acidosis? And then you actually, that would be correct in one of those states. Because if you are in a respiratory acidotic state, that means your CO2 is probably high. You're not breathing enough. So you might have thought, oh, well, in response, I need to increase my respiratory rate. And you might have selected B, and that would have led you to the wrong answer. So that's why simply comparing them to the other ones, you could eliminate all three, A, B, and C. And even if you had no idea what D was talking about, that would have led you to the correct answer.
This is me answering B all day long in school. I'm like, I understand that, respiratory acidosis, I have a high CO2. What do I need to do for that? I need to turn up my respiratory rate, drive that CO2 down. So respiratory rate increased, and I move on. And I can make a solution. And I haven't even really thought through D, and I haven't really gone through all the physiology that was just talked about. And so again, this is where it's great using the test taking strategy, because you can correlate A, B, and C, and that would leave you with D, even if you didn't have the full understanding, like Cole mentioned. So hopefully that's a helpful example for you.
So I want to finish talking about a concept, and I've already just started talking about it. This is one of the main concepts that Tanner and I both found on both the C exam and the NCE, that if you understand this, there are a lot of questions that relates to some capacity to this. And if you understand this concept, you'll be able to do exactly what we just walked through in the last question and get a lot of these correct. So I already talked about the balance between pH and CO2. They're inversely proportional. As pH goes up, CO2 goes down, etc. Hydrogen, is going to be increased when you have a decrease in pH. So they're also inversely proportional. We talked about potassium already, how as you're in a more acidotic state, so a lower pH, a higher hydrogen concentration, that's going to shift the hydrogens into the tissues. The potassium will come out and also increase. And the last one is the calcium. So calcium will compete with hydrogen to bind to albumin. So if you think about this, if you have a lot more hydrogen ions now, if you're in an acidotic state, they are going to be more likely to bind to the albumin compared to the calcium, just because you have so much more hydrogen now, which is going to leave more calcium free in the plasma rather than being bound by that albumin. So you're going to have an increased level of serum calcium floating around. So if you look at all of those and you're able to understand that and map that out, and I have to actually think in my head every time what I just walked through with you guys, because I don't actually have memorized in my head, calcium is increased when pH is decreased. Like I don't have that memorized, but I'm able to talk it through. So I know that I never have to stress about memorizing that because I understood the concept of it for all of those. And whenever I would get to a test question on the NCE or boards, or even in my regular Monday test that I'd have in school, if there'd be anything related to one of those five, and I were to see a different answer had something that also had one of those five listed there, I would instantly look at those two answer choices and see, are they both pointing the same way or are they opposite? So for example, if one of those answers had pH being low, I would say, okay, that's talking about an acidotic state. And then the other answer talked about calcium, and calcium was low as well. Then I would say, okay, that's opposite, because if I'm in an acidotic state, I should have a high calcium. So then I knew that those were opposite, and one of those were probably the right answer, not necessarily. Or if they were both pointing the same way, then I would say, oh, I don't even care what the question's talking about. Neither of those are probably the right answer. And again, that's not 100%, but that by and large, over 90% is going to give you the correct format on your answer choices.
And you could probably tell that this is not like a trick or a gimmick, that if you learn how to take these tests, then you don't have to study in anesthesia school. You're just going to fly by. You can answer everything without actually knowing the answer. It's a combination, like we've said. You have to have the knowledge. You have to have some memorization. You have to have the understanding so you can work through these concepts like Cole just did. And then this is just like the icing on top to help you work through things that either you don't know fully, or it's asking, again, kind of the fringe of your knowledge base. Or if you're just stuck, if you have something that you think you know the answer to, but you're stuck on a question, maybe the wording is funny. Hopefully, you marry all of these three things together, and this is what's really going to make for a successful test-taking experience. The next thing that we want to address here is, okay, I'm understanding some of the concepts. Now, how do I even consider studying for these massive tests? So I have, NCE, I have a C exam coming up. What are some practical steps that I can take to prepare myself for this? We get questions about this all the time. And you're going through school, clinical's crazy busy. You have a ton of workload with, your didactic program, and then you're dealing with clinical. And now on top of that, you need to figure out how you're going to study for these big tests. So this is, again, from talking with many different people that have gone through this, and then also ourselves, this is what we've come up with I think a manageable and an effective way to prepare for your NCE and C exams. So the first cycle is your understanding cycle. So we start this about 2 to 3 months from your exam. And at this point, you're just reading through material. At this point, you want to just ask yourself, does it make sense? I'm not trying to memorize. I'm not trying to even connect this to a bunch of different material. I'm trying to read through it and say, can I understand why this makes sense? Listening to what Cole just talked about with your pH, with your hydrogen, your potassium, your calcium, does that make sense? Can I track? Can I follow? So when you're reading that in the textbook, you are just seeking to understand at that point. You have so much material to get through that this is just the first step. This is the first wave. Just be reading through it, see if you can understand it. If you can't, add it to a list, and this is what's going to be your running list that you're going to come back to as you get closer to your actual test day. You should have gone through all the content for just understanding prior to 3 weeks before your test. So we say 2 to 3 months, start this, and then you should have 3 weeks ahead of time that is going to be really your hardcore study mode when you're getting ready for these tests. Again, making lists is super helpful. I did this all the way through school. So I had a running list of things that I needed to review, things that I need to go back and simply memorize that, you can't add to your understanding network that you're trying to rationalize. And so keep those lists. This is going to make your study time way more efficient and streamlined as you get into this hardcore cycle of your studying. So this is, again, 3 weeks to the exam. Now is your hardcore study plan. So go through all your content again, but at this point, you're actually trying to make sure that you have it in your memory. So this has been the most surprising thing for me, that when I did this plan and I went back through and I really sought to understand it the first time reading through, now when I'm going and I'm trying to actually keep this for memorization and understanding, I have it so much easier because I've already gone through it once and I've already made sure that in my mind, I could connect the dots and understand why this made sense. So again, you're still going through this and you're trying to still stick with an understanding goal here. And then if there's things that you need to memorize, we're not doing that yet. We're just adding it to our list. So keep your list, and that will be the next step that we'll talk about. But you have a memorization list. Still at this point, you're just going through and making sure that you understand things that you've already reviewed. The last part of this that is really helpful for me is the mock exams. I know a lot of people, if you use Apex or use Valley or use these different review programs, you'll take the mock exams throughout the time that you're studying, and then you'll use that to figure out the areas that you're weak on and go back and study those. And the only pushback we would have for that is if you haven't gone through and made sure that you understood things from a high level, then I feel like you're not getting the full weight out of these mock exams. And so we think that if you go through these mock exams, of course, it's going to expose a lot of areas that you're weak on if you haven't gone through and made sure that you understand things. We think what's better is you go through, get your understanding, and then take these exams towards the end. Sometimes that can feel a little uneasy for people because they feel like they want to have more information earlier on while they're going through their study sessions. But I would just encourage you to keep the broad picture in view, make sure you have your understanding sessions down, leave these mock exams for the end, and then go through these mock exams towards the end. So you can take these while you're doing your memorization or your second round going through, and this is what is going to add to your list. So you've gone through with understanding, you have your memorization list, you have your things that you might not quite understand as you're going through your understanding list, and then now you're taking your mock exams, and you can use those to give you even better data on the things that you need to really review and make sure that you understand.
So next you're going to enter we call the memorization phase. And this should be the last 2 to 3 days before the exam. And these are things that, as we talked about, you're not going to be able to understand everything. There's some things that they don't fit nice into those conceptual plans in your head, those mappings in your head, and you're just going to have to straight up memorize them. For me, this is things like pKa values, protein binding percentages, things that I knew that if I needed to use outside of school, when I was in the OR, as in my job as a CRNA, I could just look up. They're things that weren't going to be pertinent to something happening critically to the patient, that just anything that I knew that I would not have to have memorized moving on. And this is going to be, again, the last thing you do, because this is going to take up a lot of brain space and a lot of focus to be able to memorize all this. So as Tanner mentioned, as you go through all that understanding phase, the 2 or 3 months leading up to it, and then that second review, that's really hardcore, 2 or 3 weeks leading up to your test, start to jot down on a piece of paper those things that you notice. I'm just not going to be able to remember that. I'm going to need to memorize it the day before the exam. This is the time to do that. And so again, equations are a big thing that I did for this, et cetera. And I went through and I had probably, and this isn't a ton of things, you don't want to overwhelm yourself here, but I'm talking maybe 2 pages of notes of the most important things that I thought might be on the test that I had to memorize. And I went through and I memorized all those at this point.
I don't typically advocate for like a cheat sheet when you get into a test where you sit there and you just dump everything down that you memorized. But this is what I used for my cheat sheet when I took these big exams, NC and C, is that the things that I need to memorize, I wrote them the same way on the paper every single time. So I had my, nerve bundles drawn out. I had like Cole said, PKA values, different comorbidities for different special populations, lung volumes, those types of things. I had those all written out. So when I got to NCE and C, I sat down, wrote those out. And for me, it was just nice because if I ever had to consult that throughout the test, I knew I could. I ended up finding out that I didn't use it, but it was just reducing my test anxiety, knowing that if I got stuck and I had to remember what are the trunks of the brachial plexus, I already had that written down. I didn't even need to worry about that or think through it. I already had that on my cheat sheet. And so use that memorization period to also, if you feel like you need like a brain dump or a cheat sheet when you go into the test taking mode, use that. It was really helpful for me.
So then the 24 hours prior to the test, everybody thinks that they need to cram all the last minute things. This actually is going to do you less of a favor than if you just take a break. I was a big runner all the way up through college, and I always tell people the day before a big race, you don't see me out doing long repeated fast sprints, trying to get as much muscle strength as I can before the next day. No, you rest and relax to save your strength and build it up before you have that race. The same thing goes here. You should have all that stuff done by this point. If you want to, just to ease your own anxiety, read through that memorization list a little bit, you can, but don't, again, be trying to memorize all this stuff. You should have had that done before this last day. Go for a walk, get outside, enjoy time with family. Again, this is the reset for your brain because it needs to be as sharp as possible on the next day. So now it leads us into the day of. So the day of, don't be like me, who's always kind of flying by the seat of my pants, running in the last 2 minutes to things. Get there with enough time to set up everything. I say at least 30 minutes before the exam. That way you can just not have to worry about all that anxiety while you're driving there in the morning. Have that game plan in mind. So with the test, so it's kind of like NCLEX where you have, it shuts off after 75 questions, except it's longer. It's 100 questions before it shuts off. And then the max, remind me, Tanner, it's different than the C. The C is the full one. NCE was 175. Is that right? Is the max, I believe. And so
I took them all. I can't remember, but I took them all. Whatever the max is.
Tanner was the unlucky guy that took everything for both the NCLEX and the NCE. So.
Yeah. So if that's you, it's okay. You can still practice the CRNA. It's brutal, but you can get through it.
But it will shut off after 100 if you're at a certain level, or if you're just somebody they're going to test like Tanner and take you all the way to the end. It just is what it is. But have in your head then scheduled breaks that you want to take, some game plan. So I knew for me, I was going to take a break after 50 questions. And then I was going to take a break. If I didn't pass after 100, I was going to stop after 100, take a break, and I go forward from there. But at the same time, be adaptable. Have an open mind about things. Things change. So if you haven't heard my story, what happened, I got to question 75. So ironically, it was when the NCLEX is supposed to shut off. But again, we shut off this at 100. And my computer froze. I couldn't change my answer. I couldn't skip to the next thing. I couldn't go back. There was only one other person in the room in the testing center, and that was a girl that we were in school with, and she was always a really fast test taker, and she had just gotten up and left. So I was the only one there. I turned around, I looked for somebody, raised my hand, nobody came. So finally I go walk to the door, go out, and I told the proctor that my computer's frozen. He came and looked at it. He said it wasn't working. He couldn't even connect from the outside. He said they lost all connection to Pearson or whoever the company was that we did this through. He said it might be 3 or 4 hours before we get this thing back up. So you're probably going to have to reschedule your exam for about 2 or 3 weeks from now is the next opening we have. And this is the week before Christmas. I wanted to get done. We graduated December 12th, and my goal was to finish boards and get it all the way for Christmas. And so I was so mad because, it just changed everything. And so he's like, well, just give us a few minutes. So I'm pacing the hall. I opened the door to the hallway, and my friend who was in school with us, she was actually in our really, really close study group with Tanner and I. She's sitting there with her passing score. She's like, I passed. Are you done too? And I'm like, nope, I can't talk. I'm still in the middle of it. I'm freaking out. So I paced the hallway for a couple minutes, and they luckily got it back 30 minutes later, but the time was still running. And so I came back and didn't let it faze me, but I got to 100 and think the Lord had shut off at 100, and that was it. But you have to be adaptable. I mean, Tanner, I think, talked to his proctor about the weather or some random thing for 15 minutes on his break. That would have messed me up.
See, I just take things so much differently. And this is, again, have your game plan. So this is our point for this slide. You need to have a game plan that works for you. For Cole, he had one thing in mind, and for me, that looked very different. And while we've given you a study program that we think works and is helpful, you know yourself, you know how you study best, and you also know how you test best. So for me, I was like, I can take 50 questions at a time, and then I need a break. And I'm going to take up to 4 50-question tests today. That's how I looked at it. So after every 50 questions, I left the room. I walked around the hallway. I drank water. I ended up talking to the guy who was monitoring our exam for a while. And that was helpful for me because I could totally disconnect from the test. And then that 50 questions, if it was good or bad, was done. I walked back in there, sat down, took another 50 questions and left. And I knew that if I felt like it was going really well, or I felt like I was really struggling, that was my plan and I was going to stick to it. And that was really helpful for me to keep managing my test anxiety as I went through the tests. And so the point of this, whether you're more like Cole and you want to crank it out and, you know, have that game plan, or me, you want to take lots of breaks, figure out what works for you, stick to it, whether it's going well or bad. The problem with these tests is it feels like you don't really know how you're doing as you're taking them. A lot of them are stretching you on the types of questions they're asking. So you feel like maybe I could be answering these correctly. I don't really know. More times than not, you are, because of how you prepared, but you can easily get inside your head if you don't have a plan moving into it.